I'm going to attempt to tell you how I choose a Medicare plan through open enrollment. The very first thing I do is I get a highlighter pen and I choose just the areas that are in my area. All of the plans start on page 122, and as you can see, I've ruled out quite a few of them, and only the ones that are highlighted are in my area. And it rules out quite a few. So this narrows down the selection quite a bit, just with the very first marking. Now the second marking, you see the second box here, it says monthly premium. All right, if you'll notice right down this column here, some of these say 0, and that's how much monthly premium you'll pay each month for your insurance. But look at this one, $157, $147, $89 per month. That's how much you'll be paying per month for your insurance, and they'll deduct that from your check. But if you choose one that's 0, you don't pay anything for your insurance for a premium. So, you might want to stick with the zeros, or, $20 a month or something affordable, as opposed to $157 a month. I mean, I'm just saying that's kind of important. That should be your second mark. But don't do it like I just did. Pro tip here, don't even bother marking the ones that are 0 for the ones that are not in your area. See, don't do that. That was a no-no. Only if if you've already marked it in your area and it's in your price range. I thought $10 and under was affordable. That's what I chose. I'm a cheapskate, so hey, but because there's plenty, why pay $157 when you don't have to? So only the ones that have a highlight already. Then look for the ones that are, like I said, under $10 is what I'm choosing. So that one and that one. But this one I should not have marked because it's out of my area anyway. This one I should not have marked because it's out of my area anyway. So just to show you what not to do, only the ones, that one and that one. You see? So the next thing we're going to look at is how much it costs to go to the doctor. So your primary care visit, that's your doctor, and specialist, if she refers you to a specialist, if you have to go to the heart doctor or the knee surgeon or, a urologist or whatever. So your doctor and a specialist. So you're looking for one where it doesn't cost anything to go to your primary care doctor. You should be able to go to the doctor and it not cost you anything because you got insurance. So you want to find one that's got 0. And then, a specialist, $25 to go see a specialist isn't bad. But if you'll look, there's some that say 0. Now, these other numbers behind it are if you go to someone outside of the network. So the first number is it's $0 if you go to a specialist that's in network. And your doctor's probably going to give you one that's in network. Try to stay in network is all most people do. But if you happen to go to one outside of network, it'll cost you $45. So that's what that second number is. Well, apparently this is anywhere from $0 to $40, and then out of network is $50. That's a little bit confusing, but you see what I'm saying, though. So the next thing we're going to do is make a mark with all the ones that have 0 for primary care visit, and then anything, I'm going to try to beat 25 for a specialist because I had 25 last time, and it adds up as you get older. So, so I'm going to try to beat 25. So let's see. So my next mark is going to be all of the ones that I've already marked here and here, or, and then, yeah, I'll get back to you. Okay, so now I've went through and I've put a mark for the ones that are 0 for a primary care visit, which are most of them. And then for the specialist, anyone that was under $25 I marked. Now, if I got to one that was a deal breaker, like one that was over $25 for a specialist, or like ones that had the over $200 annual or monthly premium, I went ahead and just did a line through because I knew those were deal breakers. But as you can see, just with those few marks, I've knocked out all this. I've knocked out several pages where there's just no marks at all. Like this last page, I think. Yeah, this last page. I knocked out these 2 pages, you know, no marks at all. So I'm not interested in those 2 pages at all. And then on this page, there's only 2 that I would even consider. So if it doesn't have a highlight and a bunch of marks, I'm not even going to consider it. The next thing I would do is probably go over here to the extra benefits and make sure it's got all the bells and whistles, which most of them do. The over-the-counter program and the gym membership and stuff. And then depending on what you're looking for, chemo drugs, for instance, you know, if you have the C word, you'd look for the best deal there. If you're looking at getting more dental work done, you want to look for the best there. And then, you know, just to hurry this up, because I'm probably boring you, but the out-of-pocket limits. You want to find the one with the least number here. Like, you want to only be out $4,900 if you had to be out of pocket. You don't want one with $8,000. You know, you don't want to be out of pocket $8,000. So you would only mark the ones with the lower thing there. And also, I like to look for the ones that have no deductible. Who wants to deal with a deductible? I don't. So, as you can see, you know, I won't take you through the whole thing, but when I get done, and I'm almost done, I mean, I basically already did it, and you know, really, I should just show you the finished product. But when I'm done, I will just look for the ones that has the most yellow all the way across. And it will narrow it down to like 2, and I can make my choice by just 2, because there are only going to be 1 or 2 that has the yellow all the way across, and that's the ones. And you know, like I've already marked that one out. You know, that was a deal breaker. I forgot why. Oh, because it's $30 for a specialist. But you see where I'm going with this. So when you're done, just look for the yellow marks all the way across. That's the one you want. Boom. Now you're done, and this makes it so much easier.